So again, today's topic is our caregiver skills clinic focusing on bathing and grooming. So we've got lots to cover, so we're going to get started here right away. We've had a comment already in chat. Feel free at any time to use chat, folks, and you have the ability to chat with only myself as a host, but also with everyone. So make your selection on that accordingly. We also have Q&A open, and I'm able to see both of these windows. So feel free to put questions into Q&A and also to use chat. All right, here we go. Let's get started. So that's me, Jean, senior dementia educator. And the reason we have this slide up is really to acknowledge that I'm a certified positive approach to care trainer through the Positive Approach LLC. And this is an organization founded by Teepa Snow, who is, as I like to refer to her, as a guru kind of in this field of dementia care. And I have gone through her training to become a certified trainer using the approaches that she has developed over the course of time. And Teepa Snow has been doing this for a long time. And I can tell you unequivocally that the approaches that she uses and teaches to others absolutely work. And I know that through my time working in a memory care facility where we all went, had some positive approach to care training, and we're able to utilize that training in our day-to-day work with residents in memory care. And we saw it on a daily basis working. Did it solve all the problems? No. And what we talk about here today also is not going to solve all the challenges and problems in providing care to people living with dementia, living with memory loss. But they do provide us with knowledge and insight into what is, just as it's described, a more positive approach to providing care to people living with dementia. And it results in more positive outcomes for both the people living with dementia and for those of us who are on the caregiving side, either as professionals, but also as family members and spouses and daughters and sons and all of that, all of the different roles. So we acknowledge that a lot of the training that I'm going to be sharing with you today comes through the positive approach to care. So our agenda for today, we will talk about the brain changes that are going on in a person living with dementia that is affecting their personal care skills. We'll then talk about two of the specific areas in the positive approach to care. And so one of those is going to be the hand under hand technique. And the other is simply that initial approach to somebody living with dementia, where we're making it a positive approach. We'll talk about tips for assisting with bathing, showering, and personal hygiene, and then reference some resources for additional support. If you have any kind of burning questions or information that you're really interested in maybe getting some answers to today or getting some guidance to, please feel free to put that information in chat so that I have some ideas where your thoughts are and where your questions are. Okay, let's start with the brain changes in dementia that are affecting personal care skills for a person living with dementia. So what we're going to start with here is looking at some of the different parts of the brain and what those parts of the brain do and how that translates into challenges with personal hygiene. Okay, so in red here down below, the temporal lobe. And in this area is where we have the hippocampus, which is a very important part of the brain in forming memory and in kind of categorizing information so that it's maybe short-term memory that we don't need to keep around for much longer than a short period of time, all the way to memory that, excuse me, getting over a cold, all the way through to memory that has to go from being short-term memory into a more longer-term memory. So that's the hippocampus that takes care of all those processes. And so as this temporal lobe area of the brain is being impacted by the dementia, whatever the pathology is that's causing damage to the brain, this is resulting in rapid forgetting, disorientation, and difficulty with sequencing. Now, how does this translate into being an issue with personal hygiene? Well, quickly and easily, rapid forgetting could be forgetting that you did not have a shower today and having that continue on for several days. And so when family members are saying, it's time for you to have a shower, Mom, as a person living with dementia, you might be forgetting that you have not had a shower today nor for many days. And so it's that rapid forgetting. Disorientation can result in resistance to doing some things associated with personal hygiene and bathing and grooming, not knowing where the bathroom is, maybe to go and shower or brush our teeth or whatever it might be. But also it might be disorientation about knowing where are the items that we need in order to be able to complete that task. And difficulty with sequencing is referring to when we break things down, when we break tasks down and think about all the step-by-step pieces of a task that we need to do in order to accomplish it. So, for example, to brush our teeth, well, we have to first go to the bathroom. We have to second find our toothbrush, and then third, the toothpaste. Then we need to get the water running a little bit. And number 5, get the toothbrush a little bit wet. Number 6, we need to get some toothpaste squeezed out and onto the toothbrush. And then 7 or 8 is start brushing, making sure we get all of the areas. And then, spitting out the toothpaste, rinsing. Just think about it in terms of breaking it down. And there's a lot of steps involved. And that sequencing, that step-by-step part of the task is what people with dementia are having problems with. With regards to behavior, a lot of our behavior is controlled by the frontal lobe here, kind of behind the forehead. And how this is impacting people with dementia is some common behaviors that we see is apathy. And so, as I often say, the starter button just isn't working. And so if the starter button isn't working, then that might lend itself to not getting up out of your chair mid-morning or earlier to go and brush your teeth or to wash your face, to clean up, to take care of personal hygiene, because the default setting is apathy. I'll do it later. Or, if a family member says, are you ready to have your shower right now? And the default position is apathy, then the answer is going to be, no, not right now. The other thing we see is resistance, and we will talk about this in more detail a little bit later, but this is where we can sometimes see we're butting heads a little bit as caregivers and people living with dementia, because we're trying to get them to do and or agree to do some kind of task related to personal hygiene, and they're saying no. And then we can have fear or anxiety. This is not at all uncommon in the areas of bathing and grooming. And I think, when we kind of break that down, we can come to some better understandings of where that, excuse me, where that fear and anxiety comes from. So we'll put that aside for later discussion. I apologize for all this coughing, folks. I had a doozy of an illness. All right. So let's look at a couple of the other parts of the brain and what they do. We're talking about the parietal lobe, right here, kind of midbrain, occipital lobe back here, which is helping to govern and manage vision. And then the cerebellum right at the back, the top of the spinal cord, the brainstem. And so in these areas of the brain with a diagnosis of dementia, we're seeing changes in cognition. And so that's impacting problem solving, recognition of the function of objects, and sequencing. And again, when we kind of break these things down and think about it in terms of personal hygiene and grooming, it kind of makes sense that a person is having some challenges. And so we'll try and put that in perspective later as well with some slides showing kind of a typical bathroom. But let me just give you this thought and idea. If we go into a bathroom, and truthfully, probably most of our bathrooms are not 100% clear of items on the counter or around the sink. There may be a little bit of, we might term it clutter. We might just look at it and say, well, that's just normal for us. There's a few different things around on the counter. So let's say we're going in there to brush teeth, and now we have to figure out which is the toothbrush as a person living with dementia. And let's say, for example, this red pen is a toothbrush, and this pink pen is a hairbrush. Now, the hairbrush is bigger than the toothbrush, but they have a similar shape and kind of a similar function, although for different body parts, right? So what happens if we try to use the hairbrush to brush our teeth, or the toothbrush to brush our hair? So that's where we're having problems with recognition of the function of objects, okay? And then sequencing, we've talked about all the different steps we have to take in order to accomplish the task. And then with physical function, again, being impacted by these different parts of the brain, we're seeing changes in strength and dexterity, sensory perception, and a narrowing visual field. So how is that impacting hygiene? Well, we need a certain amount of strength and dexterity to be able to undress, take clothes off, bend over, maybe sit down on a chair or sit down on the toilet to take socks or shoes off, or to, get underwear down from, once we've got it kind of down around our knees, to get it down off of the legs. Sensory perception is important because that's what telling us, is the floor slippery here? Is the tub slippery here? Also, what is the temperature of the water? Before we're actually touching it, we can feel in a sensory manner if we're getting some heat from the water. And if we have that sensation of getting heat and we see steam, then we're much more cautious about checking the water temperature. And so if that's impacted by a diagnosis of dementia, that's affecting the ability to, execute personal hygiene and to do it well and safely. And additionally, with a diagnosis of dementia and due to damage in the occipital lobe, we're seeing a narrowing of the visual field in people with dementia. And we're going to talk about that right away here, how that is impacting not only hygiene and grooming, but also sorts of other significant areas of daily living. So here we are with the changing view for a person living with a diagnosis of dementia, the changing visual field. And so we look at this. This would be kind of a normal, let's say, panorama of what a person without a diagnosis of dementia would see. And if we just try to imagine that it is us standing here at the top of this valley, let's say, and in that imagined place, we have good peripheral vision. We can see out in these areas without having to actually turn our head and look. Okay, we've got the sense of what is out there. And as we look at this panorama, we see, there's a meandering road. We see some kind of building down there further in the valley. A forest, there's meadows there. And, we look further out and there's mountains in the distance. We get a lot of information through the visual field that we have. So how is that changing for a person with dementia? As there is dementia progression, people lose that peripheral vision. And so in the early stage, they acquire what we call scuba vision or tunnel vision. We call it scuba because it's akin to wearing a scuba mask, if you've ever worn one to go snorkeling or scuba diving. And the mask sticks out a fair amount so that your peripheral vision is quite restricted, okay? So this is what happens to people as a result of the dementia progression. And as we say, it's not that the eyes don't see this information out here, the peripheral, but it's that the eyes and the brain aren't communicating properly so that that information is being registered by the brain, okay? So already at the early stage, people can often be down to scuba vision. And if you try that out yourselves, and I encourage you to do so, think about it. Think about how much information visually that you are already missing. By the middle stage of dementia, some types of dementia, a person may be experiencing binocular or task vision. So this is where we say it's like looking through a pair of binoculars, okay? So now we're kind of losing that middle visual information and it's becoming binocular. So this lens and this lens, that's what we're seeing. So once again, we're missing out on a lot of information. And then for middle to late stage, it becomes monocular view and object confusion. So monocular view, like a monocle that the rich fella in the board game Monopoly wears. So here we are, monocular vision. You do that yourself and see how little visual information you get. If it's not right in front of you, right here in this little circle, you're not getting the information. And in the late stage, we get significant vision loss where it's really down to just a tiny kind of almost pinhole. So when we look at that over time, let's go from, I'm going to go back one from what we see without dementia and what we expect to see, and then to the early stage, middle stage, and then a little later, and then late stage. So, when we first saw that panorama of the meadow and the valley, the road, and there was some kind of structure building. Well, we're seeing now, I think, we're mostly able to discern. We see mountains in the distance and, a valley and a meadow, but we don't see the outbuilding. We don't see the road. We don't see that we're up higher on a hill looking down into this. And then here in the middle stage, we've lost sight of that meadow. I think we may still be able to discern that these are mountains here, but it's already getting a little uncertain as to exactly what it is we're looking at. And then even more so for middle to late stage, we have really lost a lot of information. And what are we looking at? It could be any one of a number of things. We know what we were looking at, so it's easy to say, well, it's probably a mountain and a valley. But, maybe it's a stormy sea. Maybe it's something else. We can't be really quite certain what it is we're looking at. And here in the late stage, all bets are off. It could be any one of a number of different things. We just don't have enough information there. So keep that in mind for your caregiving and your approaches for a person living with dementia, that all this visual information that we have and use regularly, often without thought, it's just a natural part of day-to-day life, is missing for these folks. And think about what that means in terms of how we approach them, how we introduce things to them, tasks and other things to them, in terms of what they're not seeing, what they're not taking in visually. I think it changes kind of our mindsets in terms of, how we can maybe go about this whole thing in a better way. So keep in mind, dementia causes a progressive loss of function. Again, just think about that visual field. It's declining over time. It's getting worse. Our goal when we are working with folks with dementia, caregiving for them, helping them to do tasks, our goal is autonomy for the person with dementia, not independence, because of the progressive nature of the dementia, okay? And so very important, we want to do tasks with the person with dementia, not to them or for them. And I think that makes really good sense when we think about it. Because really, isn't that something, kind of a principle that we all want in our lives? Is, if we don't know how to quite do something, a task, it's good when a person tells us and or shows us. But to do a task with us is really a more powerful tool to help us with the task than to do it for us or to us. So doing things together helps to increase the success of completing the task. Be reasonable in expectations and remain flexible. I said, do these approaches and tips and techniques, solve every challenge? No, they don't. The challenges are there, and it's a part of the dementia experience, unfortunately, for the people living with dementia as well as care partners. And so we have to both, in terms of looking at ourselves and the people living with dementia, be flexible and have expectations that are reasonable, and understand that that fluctuates on a day-to-day basis, and sometimes even on a hour-to-hour basis. We all have good days and not so good days, good times of the day, not so good times of the day. So keep those things in mind. Now, what we're going to do next is look at a training video. This is through UCLA Health, and they have this whole section on caregiver training videos. There's the URL to access this library of training videos. And I will send out after this webinar these slides that I'm showing you right now here today. So you'll get that in an email, so you'll have that information. So don't feel like you have to try and copy it all down. You will get that in an email. And so we're going to look at the first part of this. And as we watch this, what I'd like you to do is try and imagine yourselves in the shoes of the person living with dementia, first of all. And so I'm going to start it and I'm going to stop it just after about a minute. Okay, here we go. And let me know in chat if there's any problems with seeing the video or with the sound, the audio.
My mother used to shower every day. Now, if I don't remind her, she refuses to bathe at all. If I try to help her, encourage her to take a bath, she argues with me and gets upset, says she's afraid of the water. What can I do? Mom, it's 8 a.m. Time for your shower.
Oh, I don't need it. I don't want one.
Mom, come on, please. We've gone over this over and over.
No, leave me alone. Don't touch me.
Come on. It's been a week since your last one. You need one. Please, get undressed.
A person with dementia.
Okay, well, I'm going to stop that for a minute. And what I am going to invite you to do is to I'm going to ask some questions, and I'm going to ask you to put some of your thoughts and answers in chat, okay? So as we watched this, I want to ask you what happened here between the mom and the daughter. What happened? And I'm watching chat to see what we might get for some answers here. Conflict, absolutely. Any other thoughts? All right. Daughter tells mother what to do and mother does not want to. Absolutely. And kind of between those two things, that really captures it. And so daughter is telling, when we break it down in terms of what is happening to which person, the daughter's telling mom what to do. Now, why is the daughter telling mom what to do? Why do you suppose that is? She cares. I think, yeah, for sure she cares. Do you think mother will not do it on her own? Yeah. So the daughter's attempting to be directive here. And kind of, it looks to me like the daughter has an agenda here, right? She wants, it's 8 o'clock, it's time for your shower. Kind of like, let's get things going. Mom's grooming needs attention. So for the daughter, let's just put ourselves in the shoes of the daughter for a moment. How do you suppose this whole interaction made the daughter feel? Frustrated. Yeah, frustrated again. Yeah, frustrated, absolutely. And there's no question, wishing she weren't the helper. I mean, I'm sure there's times anybody who's been in, the shoes of being a caregiver, where you wish you weren't the helper. Yeah, I think that's very valid. So a very frustrating morning for the daughter. And she kind of looks a little exasperated there, and she kind of just gives up and she walks out, right? So how about the mom? How do you think the mom felt about this whole thing? Confused, sad, belittled, good word. Mom soon forgets, yeah. Upset, demeaned, embarrassed. I agree with all of those things. And let's kind of think about what we saw happening. And a couple of the things that came to my mind is, you recall the daughter just kept kind of approaching and approaching from the front, and the mom was backing up. And the mom was kind of backed up into a corner. You know, the bed was on one side, the dresser and the wall on the other, and a wall behind her. So that, you know, is not a good feeling for any of us, to kind of feel like we're being cornered. And then daughter approaching from the front. And the daughter reached out and started to unbutton the top mom's blouse. So, and I think, you know, that would lend itself to the whole idea of feeling frightened. Yes. In addition to upset and demeaned, the daughter said, no, she said, I don't need to. I don't want to. So seemed like maybe she was trying to assert her autonomy there in that moment also. So a couple of other questions I have for you then. So are there other ways to approach this whole area of trying to get, in this situation, trying to get mom to take a shower? And I think we would all agree that the answer is yes. So my question to all of you is, given what we've just watched and talked about, what kind of different ways would we approach this task to do it more differently and with a more positive outcome for all of us? And not thinking in a complicated way, just what might be some ideas that you have that might be more successful and be more positive in terms of approach. Give yourself plenty of time. Absolutely. You and the person with dementia, right? What else? How might you do things differently? Could be a week. As in, I believe what this attendee is saying, you know, maybe you don't accomplish that task right now, right at this moment. Maybe you try later this morning or later today or tomorrow. Does the shower have to happen today? So that's the part about being flexible, right? And be willing to adjust your expectations. Do it together. That's a great one. I love that. And again, that's, you know, subscribing to the philosophy of doing things together, not doing it to the person or for the person. And I'll tell you a quick story on that in a minute. Yeah, I think these are all good ideas, and it's showing us how we can kind of adapt to the situation and hopefully kind of move forward with some different approaches, learning from the experience. So I like it. So what I'm going to let you do is just listen to the rest of this presentation through UCLA Health, and then we'll carry on.
dementia will often refuse, withdraw, or fight during a bath or shower. When you're helping someone to bathe, it's important to be sensitive and tactful and to respect their dignity. Remember, washing is a personal and private activity. Bathing can be scary for patients as dementia progresses.
Okay, Mom, it's noon. It's time for your spa treatment.
Oh, I don't really want to go.
But you love the spa. It makes you feel like a queen. Yeah, and after that, we'll go to your favorite restaurant for lunch.
Well, okay, I guess.
All right, good. Let's go. So first, let's start by unbuttoning your shirt. I'm going to do the top button, and then can you help?
Okay.
Okay. Good job, Mom. Okay, Mom, I'm going to put a little water on your toes. Oh, test it. See if it's okay. How's that feel?
Yeah, it's warm.
Good. Now let's wash down there. Can you do that by yourself?
Yes.
Great. Okay, we're almost finished. I'm going to turn the water pressure on low and fill up this cup with some water. I'm going to stand up. You just sit right here. Okay? Just lean your head back and pour a little bit of water on you. And we're going to gently massage your hair with your favorite gardenia scented shampoo. How does that feel?
Yeah.
Mm-hmm.
Reassure your loved one that even though bathing is a very personal activity, you're happy to help. Ask how she feels and how she would prefer to do things. Here are some additional tips on how to help your loved one bathe. Be flexible on the time. If your loved one doesn't like to bathe in the morning, try a different time of day. If the word shower or bath causes anxiety, use a different term like spa or get clean. Make the bathroom inviting by using flameless candles, aromatherapy, or soothing music. It's important that your loved one feels safe. Install handrails and use a shower chair. Limit bathing to twice a week and give sponge baths in between. Let her know what you're about to do, one step at a time, and have her help as much as possible. Use a towel to drape over her to provide more privacy. If you don't have one available, consider installing a handheld shower head. Being able to aim the water can be helpful and less stressful.
Okay, so in the recommended response, we saw things go differently in terms of how daughter approached mom with, it's time for your spa treatment. So what all did you see different in this approach? What did you see happening that was different? Any ideas here, folks? Got mom involved, maintained modesty and dignity. Yeah, absolutely. Yeah, gave mom her autonomy, right? The focus on autonomy, not independence. By letting mom have some control over some aspects of the whole procedure. As she got to eye level, she was more calm. Using the cup, asked if the temp was okay. Yeah. And she step by step stated what she was doing and going to do. So I'm filling the cup with water. Then I'm going to stand up and I'm going to gently pour it over the back of your head to get your hair wet. And then we'll use your gardenia scented shampoo. So letting mom know what's going to happen step by step by step. And yes, giving her some control, maintained low position to not intimidate, good observation. And that is oftentimes a part of the positive approach to care is, not being kind of a looming presence over someone, but getting down to their level so you can look them in the eye. So all very good observations here. Thank you. Okay, so you'll be able to see that video and many others at the UCLA health.org website. And again, when I email out the slides to you after the webinar, you'll have this URL in those slides. So now we're going to switch gears to talk about the positive approach to care and the hand under hand technique. And so these are the techniques developed by Teepa Snow and, really the cornerstone of the teachings of the positive approach to care. And it's not, I think when we read about it, it's not anything kind of new or unusual, but I do think it's something that we don't utilize well, particularly when we work with people with dementia. And so this is something that is foundational knowledge in working with people with dementia and very, very important. So the positive physical approach, and we're limited in how I can show you all this here today because it's a webinar. But with the positive physical approach, you announce yourself and greet them. And that means you have to kind of get their attention. So that might be like, "Hi, Mom, it's me. It's Jean." And I might say, "Your favorite daughter," because then that's giving Mom information that my name is Jean and I am her daughter. If she's at a point in her dementia where she's having trouble recognizing me, that would be good information. And then I offer a handshake by extending my arm and my hand. And doing this is an invitation to come together. And people have a choice of either they can reach out and take your hand or not. And whatever choice they make is giving us information that either they are open to engaging with us or they're not. And if they do take our hand, then we can move into a supportive stance, which you'll see in the next video. The hand under hand technique involves when we offer the handshake and take the hand, so this is my caregiver hand. This is the hand with dementia. We go into a rotation so that we don't break contact. And now my caregiver hand is under the hand of the person with dementia. And I can use my strength and skill fingers. These are the skill ones. The strength ones are down here. And use that to help in some different tasks, which you'll see in the next video too. It's important to remember dominant sides. So for people who are right-handed, we'll reach out our right hand for their right hand. For people who are left-handed, we want to go the other way because their dominant hand is left, and we want to help them to use their dominant hand. So we are the ones who need to be adaptable there. And there's a part of this that we call proprioceptive stimulation, meaning closing the circuit, which you're going to see in the next couple of videos as well too. So here we go. Let's take a look. So you'll see in this video, it's actually me and a colleague, and I'm playing the role of the care partner, and my colleague is playing the role of the person with dementia. And this is using the hand under hand technique to become the skill. Okay. Now I'm right-handed and my colleague is right-handed. So watch how I do that rotation with my hand from the greeting to then you help with my hand becoming the skill hand to help my colleague with the task. All right.
Hi, Amy. Hi, it's Jean. You look
You
nice today.
can hardly hear this.
We've
Hang on.
to eat.
Let's see if I can make it better. Okay, we're going to replay that. And there's actually, hardly any volume to it. But let's just watch. So I already greeted my colleague. I sat down beside her. I'm holding her hand in the hand under hand technique. Watch where my other arm goes. Okay. Where's my little mouse here? Come on.
Hi, Amy. Hi.
I say hi.
Jean. You look nice.
Make eye contact with her.
We've
How are you
got
doing
some
today?
nice soup to eat here.
See, pick up the spoon and I put it in my skill fingers. And then I'm using my hand to help her with the spoon. And the way our hands are connected, it gives my colleague the sense that she is the one, feeding herself, okay? Although it's my hand and my skill fingers that are doing the task. And I said, take note of what my other hand is doing. And what you can just see barely, you'll see that my left hand is on her shoulder. And this is what we call, this is the proprioceptive circuit, closing the circuit. And so by putting that left hand on her shoulder, I'm helping her to get more of that sensation that that she is in control and doing this task herself. Okay. So questions here. These are the kind of things that you need to just practice and you get better at with time. We're going to have another video in just a few slides here where we see Teepa Snow herself applying these techniques. And she's actually far better at the video demonstration than I and my colleague are. All right.
Hi, Amy. Hi. It's Jean.
Hang on. There we go. So let's talk about some tips for assisting with bathing and showering. Okay, and I mentioned this earlier. Consider the environment, and there's all sorts of pieces and parts to considering the environment. What is familiar? How is the space and comfort, the lighting, the temperature of the room, the temperature of the water, distractions and clutter. And there's all sorts of variations of all of these things. Sometimes in older homes, and I'm thinking about my own home here, is, we don't have big bathrooms in our house. And even, the master bath is just a wee bit larger than the second bath, but it's not like, certainly not like the newer homes. So having two people in the master bath it's a little bit tight. And so with regards to that, not having clutter, not having distractions, feeling like there's a little bit more room to kind of breathe, to be able to accomplish a task as a caregiver or care partner is important. And so that means having the environment ready to go with all the things that are needed and with no other kind of extra things around. So let's delve into that a little bit. And I'm seeing here a comment, once in the shower, all is well. The challenge is getting there. I don't need a shower. I don't want a shower. This is crazy. And yeah, lots of times that's where kind of the conflict and the challenge is the process of getting there and getting some agreement to getting there. And that's very common. So let's see what we can talk about with regards to that. And as I say, I do have a quick story for you on that, a real life story. Come on, little slides, let's go. Okay, so I would call this a fairly typical bathroom, right? Some things on the counter. There's toothbrushes, maybe some kind of curling iron over there on the far right side, some lotions and potions and some tubes, hairbrush, some jars of things. Nothing terribly unusual. But now I want you to look at this bathroom through the eyes of somebody living with dementia. And so first of all, remember the scuba vision part of things, okay? So if it's not almost right in front of them, they might not see it at all. But I want you to think about some other things too. And I'm going to show you here just very quickly a couple of things I brought from my own bathroom. And I'm not going to let you see the fronts, just the backs. So there's this, and there's this, and there's this. So 1, 2, 3. So it's time to brush my teeth. So which one do I use? Do I use this one? Do I use this one? Or do I use this one? Which is it? Which one? You guys pick for me. Is it 1, 2, or 3? 1, 2, 3. Which tube do I use? 1, 2, or 3? 2? 1? Haven't foggiest. Thank you for the honesty. And actually, that's a really good answer because, if you're a person with dementia, you might not have the foggiest. I think we get the point. Yeah. Just for your information, number 1 is the crest. Number 2 is hair gel. Number 3 is some skin cream. So the point being, yes, that we do need to reduce the clutter. And again, ensure adequate space for movement. Think about if we do need to have durable medical equipment, like the grab bars, and maybe even grab bars around the toilet as well, too, to help people with sitting down and getting back up again. We need absolutely good lighting in the bathroom and with temperature and sound control. Sound control being, maybe we need a little bit of nice music playing. Sometimes the sound of the water rushing into the tub or the shower itself can be loud and kind of distracting. So if that's something that seems to be bothersome in some way, think about possibly playing some soft music or some spa music. Yes, minimize distractions and keep access to essential items, reasonable and have good storage. So gather the supplies you need ahead of time. And so towels, washcloths, whatever it might be, the soaps, the gardenia shampoo, whatever it might be. Get the bathroom prepared with, maybe the water running. Yes, good lighting and appropriate temperature. And again, maybe music in the background. And then look at positive and action-oriented language. And I don't know if the comment was made, I think, by Kay, Once in the shower, all is well. The challenge is getting there. I don't need a shower. I don't want a shower. Maybe you've tried these ones, but positive and action-oriented language is always better. So remember, a few slides back at the beginning, we talked about apathy and how that's the default setting for many people. And how apathy shows itself is in many ways, but often the answer to questions is no. So, are you ready for your shower today? No, no. And in fact, that's what the caregiver video showed us. The daughter asked her mom, I got the shower ready. Are you ready for your shower today? No. And she says, oh, but mom, you need to have one. And daughter says, no, I don't want one. No. And so to try and make your language more positive and action oriented, it's not just that, I've got the shower ready for you. It's come on, let's go. I've got your shower or your bath water ready for you. And maybe you make mention of that particular gardenia scented, let's say shower gel. Let's get cleaned up now. So just not asking those open-ended questions where you can answer with a yes or a no, because oftentimes you're going to get the no. Use incentives or rewards if they work. In the second recommended response from the UCLA video, the daughter says, after your spa treatment, we'll go for lunch. And if that's something that's going to work, then I say go for it. Certainly, I've worked with families who've been having challenges with bathing and grooming, who've been able to get it accomplished by saying, we're going to go see maybe a son or a daughter or a grandchild afterwards. And, we want to be all nice and cleaned up for our visit with them. And sometimes you have to do a variety of different approaches to find the one that's going to work for today. And again, what works today doesn't necessarily work tomorrow. Unfortunately, this is the nature of dementia. So again, we need to be flexible. Respect a person's need for privacy. Use towels, washcloths, or even clothing when needed, meaning in the shower, covering people with a towel, or letting them keep their underwear on, and so they get wet, and then that is maybe a way then to get them to change, because you say then, well, now your underwear are wet, so let's get you to step out of those and we'll get some clean dry ones for you. Ensure they have an active role and some autonomy in the activity. Again, here, you hold the hand shower and, scrub your parts down there or wash your parts down there. Give them some aspect to be in control of and do with them and not to or for them. So my quick story on bathing was a couple that we worked with for many years, and the gentleman was a care partner to his wife, and she was extremely resistant to showering, bathing of any kind. He just couldn't get it to happen. He tried everything, this guy did. We tried everything from our end at Alzheimer San Diego in terms of tips and techniques to give to him. None of it worked. That's my dog barking. So what ended up finally working was they had a hot tub, and prior to the dementia diagnosis, that had been an enjoyable thing for them. The end of the day is to go soak in the hot tub for 15, 20 minutes and then, go in the house and kind of start getting ready for bed. So he had this idea one day that I'm going to try the hot tub. Well, turned out she was happy to get in the hot tub. So the hot tub became the way he got her to get immersed in warm water and hot water, and became the next best thing to a daily shower. I don't recall if he ever took soap into the hot tub. He might have. I think sometimes he added some like bubble bath or shower gel to the hot tub. And yes, it would get foamy. And it meant he had to clean the hot tub and, kind of pay more attention to the maintenance of the hot tub. But it was the thing that worked. And in fact became, it was something that she enjoyed. It became, a pleasurable activity. And so for him, he said in the end, having to do some of that extra work to keep the hot tub cleaned and working properly, he said was well worth it. So moral of the story there is, I guess, keep trying and for sure talk with us, and hopefully the combined experiences and knowledge of all of us will help you to come up with some tips and ideas that are going to work. We're going to go back to being flexible because we've just talked about that with regards to this family that I told you about. Consider washing hair as a separate activity from the bath or the shower if needed. You can use bed baths. There's dry shampoos as well too. Let go of unreasonable expectations and consider your own physical limitations, safety, and well-being. The question in chat is, have walk-in tubs been successful with bathing? And I have limited knowledge on this only because, my understanding is these tubs are fairly expensive. So I haven't myself talked with a lot of families who have those tubs. But what I will tell you, the families that do have those tubs have been successful. For people who far prefer a bath over a shower, getting in and out of the bathtub can be a real challenge. Because we have to step up and over, then we have to, get down, crouch down and sit down in the tub, and then getting up and out of the tub, all of that as well too. And as we become older, it gets more challenging. And then we add in the mix of dementia and it's more challenging. So if baths are absolutely the preferred method of doing things, then you might consider a walk-in tub. Much easier to maneuver. The seat is high, so once the door is closed and sealed, the person doesn't have to do this big effort to go down or get back up again. And I don't quote me on this, but I think that the way some of these tubs are situated, that you could also use a handheld shower in them. So having a bath, but maybe using the handheld shower to do the hair or wash the hair or whatever it might be. So it might be worth it to look into. I want to go back to being flexible and considering your own physical limitations. And a comment that came up earlier from a person that said, maybe have a shower, do it together. Yes. And actually, I've worked with quite a few families, spousal situations, where that is in fact what the spouses do. The person living with dementia and the care partner is they shower together. And I'm thinking of just one family I worked with in the not too distant past. The male was the caregiver to his wife with dementia. And he started getting in the shower with her because he told her he needed her to wash his back. So that was the reason. And so she would wash his back. And then of course he would assist her with washing and stuff too, and help with washing the hair. And it was very successful approach versus him trying to kind of tell her what to do and get really directive with her about you've got to have your shower now today. So it became something that they did together. So another good example of doing with, not to or for. All right. So tips for assisting with personal hygiene, and we're going to just touch on a couple of different things. So again, clear the clutter and get the essential supplies out, and simplify and minimize grooming products and tools. We just don't need to have kind of all that stuff happening to us anymore. Simplifying is just an easier way to go about things, and respect personal preferences and routines as much as possible. Do try to either stand or sit at their level whenever possible. Now, a couple things that come to mind with me is there's a picture of a, electric razor here, and shaving for men, I have through my career seen, I guess, both sides of things. For some gentlemen, I've seen, the whole idea of using a shaver or a razor has become just too challenging and too perhaps frightening, like not understanding what's going on, what's happening. And so shaving just becomes something, that you don't worry about. Caregivers are assisting with keeping the facial hair clean, again, in the shower and by washing the face and with soap and water, and trimming facial hair around the mouth and the nose area as is needed. You can get some great safety scissors that can help with that. I've also worked with some gentlemen who've been super focused on shaving and wanting to get a razor out or a shaver out all the time. Some different things I've seen work with these gentlemen is taking the actual razor heads out of the electric shaver so that it still runs and bzzz, and it feels like the person is shaving, but there's no cutting action going on. And I've also seen use of handheld, razors, not taking the cover off of the blade, so the person can go like this all day long, but the razor's not pulling at the skin. And alternatively, I've seen some people using, again, those disposable handheld razors with the blades removed so that the gentleman can continue to feel like he's shaving when he's not, but he's going through the motions and, feeling good about that. So we do want to respect those personal preferences as much as is possible. And again, also with keeping kind of simplifying things in mind. Let's see what else we have. Provide verbal or physical prompts if necessary, and use visual cueing. And one of the things you've seen me doing here today in the webinar for visual cueing is, going through the motion that we would go through to do something. That kind of thing is really helpful for people with dementia. It gives them that cueing about what it is we're about to do. And then use your positive action oriented language. Use this one. Try it this way. And take steps one at a time. So for oral hygiene, it's really important. It's important for all of us. And people with dementia, without good daily oral care, they are at risk of infections, problems with chewing, weight loss, and pain. And I've seen these things happen over the course of time. Oral hygiene is something that can fall by the wayside fairly quickly, until such time as we notice, say, breath odor, or we see visibly that the person has not brushed their teeth. We can see food caught within their teeth. And if it's gone to the point where we're seeing poor oral hygiene and smelling bad breath, it's maybe gone on for a little while. So there might already be some infections and some gum swelling and things like that going on. So we want to keep an eye on these types of things. Look for changes in facial expression, as in wincing when eating or drinking, a change in appetite or not wanting to eat. If a person is wearing dentures or partials, they may have difficulty wearing them or refuse to wear them. Again, we're looking for swollen, bleeding gums or bad breath and difficulty with swallowing. So to keep an eye on all of these things, and yes, to continue having the person living with dementia seeing a dentist on a regular basis. And I'll tell you, there are mobile dentists who can come out to the home to do some basic oral hygiene, a cleaning and an examination. And these are people who work not only with the elderly who may find it challenging to get into a dental office or find that the chairs that go back so far are uncomfortable, whatever it might be, but also they're quite well experienced in working with people with dementia. And, that's the kind of thing, talk about with the dentist that you have currently, see how your person with dementia responds to the dentist. If you need to make a change, you want to be identifying somebody who has worked with people with dementia. You think about the whole dental experience. It's kind of strange anyways. And if you try to imagine yourself as someone living with dementia, it would be even more so. So come to us with those questions. We have those lists and that information. So let's see here. Again, doing with, not to or for. Brush your teeth together. Use a soft bristled brush, or electric toothbrush is a good thing. If you can't get a person to accept having a toothbrush in their mouth, you can get moistened gauze pads, moistened with things like Listerine, but also dental cleaners. There's also fingertip toothbrush that you can get that fit over the index finger that you can go in to use to give a little scrub around. And schedule those professional cleaning appointments for as long as is possible, as long as the person with dementia is able to tolerate it. So I'm going to let you see a quick bit of, this is Teepa Snow, showing how to help a person living with dementia brush their teeth. And what you're going to see here, she's doing the hand under hand technique. And it's a good video showing, how to do this task of brushing the teeth, and also a great illustration of the hand under hand technique. So here we go, a couple of minutes.
So here's a meal. So you right-handed or left-handed?
Right-handed.
Right-handed. Okay, so turn this way a little bit so everybody's going to be able to see us. Now, before I had you do hand under hand, right? Now what you're going to learn how to do is be the fine motor when they're losing it. The tool manipulation. So the reason I want her hand is her brain remembers her hand coming to her mouth. The reason I need my hand is she doesn't know how to manipulate a toothbrush anymore. So what I'm going to do is do the toothbrush. She is with me, and by being over here to the side, guess what? She literally thinks what? She's brushing her own teeth. Notice that I have my hand on her shoulder applying downward pressure. I'm tricking her mouth into not paying as much attention. Now you notice, it's a little bit tender around here. She's not real fond of this. But let me take away the hand and watch what happens. Much more intense because I'm actually tricking her brain. This is close and it's proximal, and so I'm actually tricking her brain into paying attention to the pressure on her shoulder. Now watch this. So does it make a difference? Yeah, so I want each of you, and here's the deal. If you're going to be really good at this, you have to master both sides because you will have residents who are opposite dominance of you. And it doesn't matter what your dominance is. You have to use their dominance unless they've had a stroke, and you may have to use the remaining side. The reason you want their dominant side, that's where all the brain history is for fine motor tasks. Only one half of your brain has learned fine motor skills. The motor memories are not available on the other side. And so I've got to be on this side. It's also where it's going to draw her eye. Search and rescue will always tell you if their right person is right-handed, they'll make right-hand turns. If they're left-handed, they make more left-hand turns. It's an automatic behavior of the brain. So she will look at me more and pay better attention if I'm on her dominant side.
So there we are. Teepa Snow herself showing, how we can do the task of brushing teeth. And again, she's using that hand under hand technique. And you can go to, again, you can see her website, www.teepa, T-E-E-P-A, Snow, S-N-O-W, and that should be .com. And some of her videos are free on YouTube. Actually, a fair number of them are free on YouTube. A lot of her information on her website requires purchase, but have a look and see what you can get simply as a caregiver, and look on YouTube as well too. So I see a question kind of here in
So with your partner, give it a try.
next. Let's just say, again, to stay flexible, keeping in mind the importance of personal care and hygiene to not only well-being, but self-esteem. But again, maintain reasonable expectations. You need to consider your own physical limitations as well, too, skill and comfort. There are some relationships we have where we're not going to do something like get in the shower with them. If I'm a sibling caring for a sibling, I'm not likely to do that, nor if I'm a son caregiving for a mom or a daughter for a dad, that is something that, I'm not likely to do. So, we have to kind of think about those things in terms of also when we're trying to be inventive and flexible in doing things. Look for others who may be able to help with ideas, with tools, or with physical assistance. And so let's have a look at a couple of these comments and questions. Let's see here. So, like this, mom is holding saliva in the mouth, refusing to spit out, holding in mouth for hours. And so what I would suggest first and foremost is an evaluation. See the dentist just to see, is there something going on gum-wise or tooth-wise that's causing discomfort and is resulting in this behavior. And if everything is okay there, you might want to try seeing actually an occupational therapist. And they can do a swallowing assessment to see if mom is having some problems with swallowing. And that's why she's holding the spit in her mouth for hours. So that would be my recommendations. I guess one question I would ask is, does she do the same with food? Does she pocket food in her cheeks? or just kind of hold it in her tongue for a period of time too. And no, the answer is no. So I would say start with the dentist and then maybe go with the occupational therapist. And if everything turns out okay, I'm quite sure the occupational therapist would have some ideas on how maybe to get around this particular situation. It's a common area of problems and concerns for occupational therapists working with elderly people, which they often do, and particularly elderly people with dementia. And so they are really well equipped to assess that and give you recommendations, almost like a reflux of some kind. And that could be. And the occupational therapist or the dentist might say, look, maybe get the doctor involved. So, but I think I would start with the dentist and then the occupational therapist and then go from there. Any recommendations on handling mom thinking water in the home is recycled water and dirty because it's old newscast, because I'm not quite sure. That's probably some spell check that's working there that's messing up. Any recommendations on handling mom thinking the water in the home is recycled? Well, I mean, I think one of the things that, and I think many of you would agree, is trying to reason with a person with dementia about their beliefs can be completely unsuccessful. And again, remembering that, saw a previous news story, thinks the water in the home is recycled. Okay. It can be very, actually just frustrating with no good outcome and trying to reason with a person with dementia that, it was just a news story and it's not, it was talk, it's not something that's actually happening. So I would kind of throw all that, trying to use reason and logic and explain it away. Just, don't even try that. If she thinks the water is recycled, then just accept that the water is recycled and go buy jugs of water or bottled water and, let her, it's kind of a pick your battles thing. Let her believe that the water's recycled and buy your jugs of water for her to use for drinking, maybe brushing her teeth as well too. It's probably something that at some point in time she'll forget that she has this thought. But for the here and now, that would be my suggestion, is just, let that be a battle that you don't fight and just start bringing home the bottled water for her. Suggestions for encouraging complete wiping when using the toilet. So there's there's a lot of different kind of wet wipes that are available that are intended for use in the bathroom after we've used the bathroom, after we've urinated or had a bowel movement. One of the things we do have to be careful about is, are they truly flushable? And there are many wipes that claim to be flushable that in fact are not. So you need to do a little bit of research on that. But I would suggest using wipes once you've identified some wipes that are truly flushable. And I'll tell you, there's some bathroom wipes you can get on Amazon that are flushable. I wish I could, but I can't remember the brand name. They are also not like just small wipes like the baby wipes are. They're much larger. And to be able to use 2 or 3, the recommendation is if you don't use 3 or more to flush down the toilet. And 3 would be plenty to use because of their size. And they are, again, larger. So the idea being they can cover a larger amount of the skin area and, then get that area cleaner in kind of less wipes. So that is a thought there. The other thing, and this might not be practical at this point in time, but I have to put a plug in for it, is the use of bidets. And you can get toilet seat bidets that you can install on your toilet, easy peasy, and just get it plugged in. And use of bidets, so then it's sending a mild jet of water up to the the perineal area, so around the anus, and also then you can have it change the angle so that it's around for women the urinary area, the urethra. And it helps, it really does help to get those areas cleaner and be able to use less wipes, whether it's toilet paper or wipes. But the thing about that is, if somebody's not used to it, used to using a bidet, or has and finds it really uncomfortable or kind of maybe frightening, like, oh my gosh, what is that's happening? Then that can be a challenge. I think it might be worth a try. There's a cost involved, of course. There's different kinds of bidets, all the way from something very basic you can order from Amazon to, actual getting a toilet installed with a bidet. Obviously, I think it's better to start at this end of things to see if it's something that might work. So those would be my suggestions there. Again, looking for wipes that are truly flushable and that are larger in size. The small ones that are great for babies don't cover enough area for us as adults. And, rather than using 5 or 6 or 7 baby wipes, to use 1 or 2 or 3 of these larger ones gets the job done better, using less wipes and using less, a shorter period of time, less action involved. So those are my suggestions for those items. Now, let's see, resources for additional support. Well, call us at Alzheimer's San Diego, and we can point you in a variety of different directions. Know when it's time to reach out for additional support. Don't wait till you're in a super stressed, super frustrated state to ask for help. Have a safety net. And if you don't have a safety net, call us so we can help you to begin building one. And then, of course, we'll put you in the right direction with resources. So that could be professional in-home care. Again, it could be physical or occupational therapy evaluation. These folks, these therapists, I mean, they're great resources for aging adults with challenges in day-to-day living, with home modification kinds of things, with evaluations of things like swallowing. And they're very good and well equipped to handle the challenges of an aging person living with dementia. Look at the adaptive equipment that's available, and look at respite as a caregiver to get a break from the 24/7 of the role and responsibility. And we can help you with that at Alzheimer's San Diego. So there we are. We have our clinical services team answering the phones Monday through Friday, 8:30 to 5 p.m. And we have all sorts of information. You don't need to go out and seek it. We've got it. Just give us a call and tell us what you need. You need a list of dentists that are mobile dentists? We've got it. You want a list of stores where you can get medical equipment? We've got it. Kind of you name it, we've got it. So give us a shout, please. And of course, we have all sorts of other things going on as well too. Support groups, all sorts of education and training, some companion programs providing respite for caregivers. So contact us. And again,